You know, in about a decade ago, when I worked with the Prime Minister, Netanyahu, he once told me, when you give a presentation, don't compete either with children nor with lunch. Let's see if he was right, okay?
We're now competing with dessert.
Yeah, dessert is even worse.
Hi, Eyal.
Hi.
It's really a pleasure to have you this afternoon here.
Thank you very much.
Meuhedet will be a key partner in a new public hospital that will be built in Be'er Sheva. Why is that project so significant?
Well, this is amazing, especially for the Negev region. The Negev region is a huge region, you know. Once upon a time, Ben Gurion said the future of Israel is at the Negev. Over 1 million people enjoy the services of an excellent institution, Soroka, but it's only one institution, only one hospital. In the center of Israel, people get services from 10 different hospitals. There's competition, much better services, more availability.
And they can choose what hospital they want to go to.
Exactly. And in the Negev, they have only Soroka. The government rightly decided to open another hospital, which will be owned by Meuhedet and will be built together with Sheba and operated together. And this is very important. First of all, it's competition. And second, we can give seamless services. You know, now the trend, modern trend in health services is shorter hospitalization and longer extended homestay. So we are going to give these services much more advanced treatment to our patient, and it will allow us to give the whole region much better services.
Thank you. 1 hour after October 7th broke out, you opened mental hotline for people in distress. How did you have the power to literally do this so quickly?
Well, first of all, the need for emotional support. I think everyone who endured what happened in the same morning felt that he needs support.
Yeah, everyone was in shock.
Everyone was in shock, but especially people who hid in their homes. Nova participants who were in the bushes for hours, sirens, people that ran away to shelters. And because we are very, very fast-moving HMO, we were able to recruit our staff, our social worker, our psychologists, and open the hotline. And thousands of people approached this hotline. Actually, mental health services up until now are very active and very important in building the resilience of the Israeli people currently, because we must make sure that the trauma that we endured will not become a post-trauma, that it will go away, that we'll be able to cope with that. And because we give comprehensive services to our patients, this is a pillar service that we must provide.
And with thousands of misplaced, civilians in the country of Israel, you opened mobile healthcare centers traveling around the country. So you're giving them more support in different places and where the need is.
You know, when the Kupot Cholim were preparing for the coming war, and we just came out from the COVID, Israelis used to think about the next war as about 35, 40, maybe 60 days. Nobody foresee a year and a half and even more than that. And when the war erupted, people were evacuated to hotels, to evacuation centers, and so on. And we understood it's going to be very long, and we must bring the services to them, not make them travel to clinics or something like that. So first of all, telemedicine was very important. doctors that went to the hotels and so on, but there are services that need to be mobile. Let's take, for example, women's health care. And this is something that you need all the time, and equipment is needed, and you need to bring it to the evacuation centers. So we opened a mobile healthcare units that were traveling around the country and providing these services, and we made sure that we give the right treatment without any interruptions.
Yeah, amazing. You recently opened a new healthcare center in Sderot. Why is it so important for you to invest in southern areas in Israel?
Well, the periphery is very important to us. Sderot, everyone knows what it went through. Actually, you know, when we had the ceremony of the red ribbon in Sderot clinic, we had the honor to have the Minister of Health. And on the very same moment that we were going to cut the ribbon, siren went off. The minister and myself are not regular to 15 seconds alert, so I must tell you we didn't make it to the shelter in that time. But then we went back, opened the clinic, and people were coming. This is part of what we are. We are over there all the time, giving the treatment. It's unstoppable, and we must make sure that people in the periphery enjoy the same services that everyone else in Israel enjoy.
Yeah. Looking ahead, what are the key areas in healthcare that you expect to grow in?
Well, there are many, but we discussed a lot of the South. Let me say just another story about the North. In the North, for example, we provided all our personnel with protective gear, helmets and vests. And one of the stories that one of our professionals giving home care services were going on the road between Carmiel and Sachnin, which is very symbolic, between a Jewish city to an Arab town, to provide home care. A siren went off. She took the ditch on the side of the road. The rocket hit the hill next to her. She got up and continued her trip to Sachnin to provide the services. This is exactly what Meuhedet is made of. And for the future, first of all, we must maintain this personal service, very dedicated services. This is exactly our soul, and this is what our patients are expecting us to do. Second, technology is amazing. AI. You know, some medical services, health services provide solutions, provide medical assistance to an illness. We need to be preventive. We need to diagnose before the illness erupts. This is exactly where AI can help us, and this is what we are bringing to the edge of our services currently, and the future is looking very interesting in that sense.
Well, thank you for staying so updated, everything to do with healthcare, and thank you for being here and sharing tonight or this afternoon with everyone this amazing innovation.
Thank you very much,
Thank
and
you.
I really appreciate the opportunity.
Thank you.